Alright, so we know that wRVUs are a way of measuring how much work a physician has done, and it's common to use a wRVU in an academic setting and not as much so common to be used in a private practice setting. In a private practice setting, you'd probably look at the fee to determine how well you've performed, how hard you've worked. The more money you've billed for, the harder you've worked, and the less money you've billed for, the less hard you've worked. But in academic centers, that's not necessarily the case because a lot of patients are uninsured, and so they wouldn't pay you, and it would appear that you're not working so hard. So you look at the wRVU, which is independent of what the patient can pay, and that's a good quantifiable measure of how hard a physician works. So I have 4 scenarios here. A new outpatient visit, OV is outpatient visit, billed at level 4. An established outpatient visit, billed at level 4. A kidney biopsy, a native kidney biopsy, and a vas cath insertion. Now each of these have codes, and the codes are assigned by the AAMC and CMS. So all you have to do is just look up the code, and I'm going to give them to you for the sake of this particular tutorial. This is a 99204. So it's a 99214, 50200, and then a vas cath is 36147. They look like zip codes, but they're CPT codes. You can punch in CPT codes in the physician fee schedule search website, which is on the Nephrology On Demand app, which is probably where you're viewing this tutorial from. You can punch in these codes and it will give you the most updated wRVU. So these are the wRVUs from 2013, and they generally change every 5 years. CMS is supposed to evaluate these every 5 years. But for the sake of this tutorial, I'm just going to jot down what the wRVUs are for each of these procedures or services. It's 2.43, 1.50, 2.63, and 3.72. Alright, so that's the wRVUs for 2013, and I'm also going to show you the fees that you or your administrator would bill for if you had provided any one of these services. So for a new outpatient visit, and this is going to be in dollars, $330. For an established outpatient visit, it's $215. For a kidney biopsy, $1,191, and then for a vas cath, $1,985. That's not necessarily how much you would get, but that's how much your administration would bill the insurance company for any of these services that you provided. So now let's take a look at this. At face value, it sort of kind of looks like the greater your wRVUs, the more money that you can bill. For the most part, that's true. The more wRVUs you get, the more money you get. But it's not a one-to-one correlation. You can see if you double your wRVU from 1.5 to about 3, this is not exactly 3 but close to 3, you're not doubling your fee from 215 to about 500. You're almost increasing it by a factor of 4. So this relationship between wRVUs and fees is not a linear relationship. It's not easy for you to predict how much extra money you'll make if you increase your wRVUs by 30 or 40 or 50%. You'd actually have to look at the services you provided and tally up the fees that are associated with those services if you wanted to know how much extra money you can bill for. The second thing that isn't mentioned in a lot of these spreadsheets, and I'm going to mention it here, is something called time. And for a physician, I think this is the most critical aspect of understanding the wRVU. Say, for example, it takes you 60 minutes to do a vas cath, okay? And it takes you 60 minutes to do a biopsy, and that includes setup time, consent, cleanup time, all of those things. It takes you an hour to do those things. And say it takes you about 20 minutes to see an established patient and about 30 minutes to see a new patient. So one of the questions you may have is, if you just look at the wRVUs and you don't look at the time, you'd say to yourself, I need to do a lot of VASCATs because I'll get 3.7 wRVUs for each one, and that's a lot of wRVUs. That's the highest amount of wRVUs in this simple example that I'm showing you. But what you don't realize, because this table isn't always given to you, is it may not be the best use of your time for the amount of wRVUs you get. Let's take a look. If it takes you 60 minutes to get 3.7 wRVUs for doing a VASCAT, then how many wRVUs can you get if you see 3 established patients? Because 3 times 20 is 60. So that's 1.5 times 3. So if we extrapolate this, that's going to be about 4.5 wRVUs. Much greater than 3.7. Say you have a new patient. Well, if it takes you 30 minutes to see a new patient, you can only see 2 new patients, and that's going to be about 4.8 wRVUs. More than you'd get with a VASCAT. And of course, it takes you an hour for both, so it would be more lucrative for you to do a VASCAT than it would for a biopsy. But the point of this example is outpatient visits, whether new or established, will probably get you more wRVUs than doing a VASCAT or a biopsy, even though these are actual procedures that are in the hospital, and these are procedures that bill for a lot more than these do. If you saw 2 new patients, you'd still bill a fee that's less than 1 VASCAT. If your compensation is based on wRVUs, then it shouldn't matter to you how much you bill. What should matter to you is how many RVUs you can accumulate. If you see 3 established outpatient visits, that's about $600, maybe $645, $650. That's actually more than half less, more than 50% less than what you bill here, but you'd get more RVUs. So you need to ask yourself, and in your contract, how are you being assessed for your salary? Are you being assessed based on the amount of money that you bill, or are you being assessed based on the number of wRVUs you accumulate? If you accrue wRVUs and that's the way you're being paid, then this strategy of seeing more outpatient visits is probably more lucrative than doing some high intensity, highly skilled procedures like biopsies and VASCATs. If your compensation is based on the money you bill, then these are probably procedures you'd want to do more of than these services because they pay more or you bill more. In the last video, we're going to talk about how wRVUs when it comes to procedures, when it comes to services, is a little bit different than when it comes to procedures. There's one other thing that I'd like to discuss, and then you should be pretty much familiar with how wRVUs work.